Welcome to the 302nd of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at the Korea Advanced Institute of Science and Technology. I'm coming to you live from Daejeon, South Korea. Today, I'm joined by Sari Altschuler, the founding director of the Health, Humanities, and Society program at Northeastern University. Just a reminder, you can usually catch COVID Calls live on weekdays at 5:30 p.m. Eastern Time. Just go to the COVID Calls YouTube channel to watch. You can also hear COVID Calls anytime recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. Also keep up with COVID Calls via Twitter using the handle @USODisaster or @COVID Calls. Please do help spread the word and send suggestions for future guests and future topics, and please feel free to suggest yourself as a future guest. As of today, July 1st, 2021, there are 3,947,163 deaths from COVID-19. That's globally, according to the Johns Hopkins University Coronavirus Resource Center. In the United States, 604,714 people have died from COVID-19. In Canada, 26,273 have died, according to official statistics. As a way to bring some humanity to the numbers, I've been reading a life story or a story of advocacy for those impacted by the pandemic, and I'd like to continue that now. The headline is, Canada's real death toll from COVID-19 may far exceed official tally. Was written by Avis Favaro and appeared in CTV National News June 29th this year. The number of Canadians who have died because of the COVID-19 pandemic is likely double that shown in the official numbers, according to a disturbing new report published by the Royal Society of Canada. It was pretty devastating, actually, and pretty shocking. Tara Moriarty, an infectious disease researcher with the University of Toronto and one of the authors of the report, told CTV News. The report, which looked at excess deaths, suggests that largely racialized communities and essential workers were the ones caught in the crosshairs, often perishing at home and going unreported as COVID-19 deaths. The study reviewed death reports in 2020 and compared them to the expected number of deaths in a normal year, finding some 6,000 extra deaths among those aged 45 and older between February and November of 2020. Assuming this pattern of missing deaths continued after November of 2020, it's possible that as many as 50% of deaths missed being counted as COVID-19 deaths and included in that official number, the report suggests. This could mean that instead of the 26,000, and now more than 26,000 since this report came out, deaths, in Canada, up to 52,000 Canadian deaths may be linked to the pandemic. They weren't recognized as COVID-19 deaths for whatever reason, and there are quite a number of possibilities, and they vary by province, Moriarty said. What it really looks like right now is that the COVID death toll is very likely to be double what we think in all regions outside of Quebec. The report detailing this enormous oversight is a complicated indictment of Canada's response to COVID-19, exposing a failure to test, report deaths consistently, and to pay attention to marginalized communities. Moriarty said she started to realize something was off while she was tracking long-term care deaths in Canada. I was looking at things like the case-for-case fatality rates in Canada, and the numbers didn't seem quite right, she said. Over time, I started realizing that, in fact, there were quite a few more deaths than we had expected, and so it took months to sort out, let me take that again. It took months to sort of be sure that what I was seeing was likely COVID-19 deaths. She explained that researchers adjusted for an aging population as well as the amount of deaths due to toxic drugs and still found a disparity in the excess deaths. Right now, the official data for COVID-19 deaths in Canada suggests that about 80% of COVID-19 deaths occurred in long-term care homes, but the report says that's wrong. Like most other countries, 2/3 of our deaths likely happened outside of long-term care, when the elderly living at home and lower income racialized frontline workers became ill. That suggests that people have been dying in their homes unrecognized with COVID-19, Moriarty said. And for them and their families, for everyone, we need to understand exactly how that could have happened, because that's That's actually quite horrifying. The report also cited a study that had looked at cremation records in Ontario in 2020 and found that there was a rise in at-home deaths, with 63% of excess deaths occurring there as opposed to only 30% in long-term care. Dr. Onye Noram, president of the Black Physicians Association of Ontario and an assistant professor at the University of Toronto, told CTV News that this report hits hard because the communities affected had tried to raise alarm bells earlier in the pandemic and they were ignored. That's why I cried when I read the documents, he said, because people had been shouting from the margins, saying, please look at what's happening. Can you save us? Can we do something? Can we mobilize resources? Can we have sick days, paid sick days for people working in these communities? These cries were not heard. She said we need to ask why these deaths were ignored, explaining that while the report refers to these deaths as unnoticed, she believes this term is insulting because communities have been speaking up about what they've witnessed and how their community has been affected by COVID-19. It was willful ignorance to ignore what was happening on the ground, she said. She added that many essential workers doing jobs in home care and on the front lines, in formal and in informal caregiving, tend to be women, and that we may discover that a number of these preventable deaths were women. The numbers aren't just numbers. Those are people, those are families, those are lives. And this potentially was preventable and predictable, she said. One of the problems that led to these deaths failing to be counted, according to the report, is that Canada tested 75% less than the average for peer countries early on in the pandemic, missing cases until doctors spoke up, recognizing atypical symptoms. Dr. Samir Sinha, who works in geriatric medicine at Mount Sinai Hospital, published a case report early on in the pandemic detailing a woman who presented atypically and then was diagnosed with COVID-19 2 days later. We probably lost a lot of deaths being reported from COVID-19 because there just wasn't any thought to actually investigate those deaths, even in a post-mortem way, just to actually do a test and say, was COVID a factor? He told CTV News. When physicians are filling out death certificates, for example, they'll often actually say, well, the main cause of death was, say, a heart attack. And then they might actually put another condition like dementia or other things with it. But again, if COVID-19 wasn't suspected, then it's very likely that wasn't even factored in as a potential cause of death. Another contributing issue in having accurate death records is that Canada's requirements for filing death reports are lax. Every one of our peer countries legally requires deaths to be recorded nationally within a week of them occurring, Moriarty said. Canada is months to years behind. We don't have any requirement for that. If we had been able to spot deaths piling up early on in 2020 with faster reporting, it might have provided a real warning that would have been really important, she said. There's still incomplete data even now, she pointed out. We don't have complete cause of death reporting in many provinces past February of 2020. The standard on how to report COVID-19 deaths also varies from province to province, another roadblock to accurate data. It's imperative that we learn from these uncounted deaths, Moriarty said, adding that we could still be undercounting deaths right now. This could be very important as the Delta variant spreads, she said. If we don't learn from our mistakes, it could cause more unnecessary deaths in the future. The news report, written by Avis Favaro, was Canada's real death toll from COVID-19 may far exceed official tally. Okay, I'd like to turn to my discussion for today, and let me introduce my guest, Sari Altschuler. Sari Altschuler is Associate Professor of English and the Founding Director of Health, Humanities, and Society at Northeastern University. Her work has appeared in leading journals, including American Literature, American Literary History, PMLA, and the medical journal Lancet. She's the author of The Medical Imagination, Literature and Health in the Early United States, which appeared with the University of Pennsylvania Press in 2018, and the co-editor of Keywords for Health Humanities, which will be appearing with NYU Press. Sari Altschuler, thank you so much for making time to talk on COVID calls today.
Oh, thanks so much for having me.
I'd like to start the way I generally do, just find out where you're calling in from. what the pandemic and vaccination situation looks like there.
Yeah. So I'm calling from Boston, and actually, kind of surprisingly, we're doing quite well in terms of the United States. I think the state has one of the highest vaccination rates. I believe that the numbers last I checked look something like over 70% of people in Massachusetts have been vaccinated, fully vaccinated. Oh, sorry, that's one shot of the vaccine, and over 60% are fully vaccinated. So we're doing pretty well. The numbers of infections are low, and the Boston Globe today reported that they think that the effect of Delta will be blunted by the vaccination rate. So there's some hope, especially because the neighboring states are also have been very good about vaccinating. So fingers crossed, but obviously this is still the middle of the pandemic.
And what are the implications for campus? Have you been back? Is this something now approaching, full? I guess we're into summer now, but how were things looking at the end of the spring, and what's the plan for the fall?
Yeah, the campus, they've really tried to keep it open. And so they were testing everyone 2 to 3 times a week who was on campus, although with some struggle, they finally let faculty choose whether or not they wanted to be on campus. It looks like we will be on campus in the fall, but everybody will be required to be vaccinated. So that seems predictable to me in terms of the spirit of the university, and about as good as we could ask for, probably.
I've been asking guests who are based in North America, not because the pandemic is over, but because it has shifted to the next act, whatever that is going to be, if they wouldn't mind sharing some memories or associations about the pandemic. I've been particularly eager to ask you this question as a person who's so attentive to, we want to talk a lot about literature and narrative, but as a person who's so attentive to narrative, I've really been dying to ask you this question. So what are your strongest associations with the pandemic?
Yeah, I mean, I think probably what was weirdest for me was there's sort of two moments that are weird. I think I had a sense of the pandemic and the urgency of it a bit sooner than a lot of other people. My partner's working on a project about historical epidemiology before the pandemic, and talked to an epidemiologist at Harvard in January who said, absolutely, January 2020, absolutely, this is going to be a pandemic. So we started preparing then. I was then a visiting professor at the University of Paris for 2 weeks, and I knew I was right on the bubble. But from the end of February through mid-March. And I awoke one morning, I had my phone on airplane mode, which I don't recommend in the middle of a global crisis, to find out that while there had been no warnings about France when I had turned off my phone, when I had turned it on at 2 or 3 a.m. Paris time, all of a sudden there was a travel ban announced. I had to get out of the country. So for me, that was really the most memorable thing about the pandemic, was rushing to try to get on a plane before I got stuck in Europe. I have a 1-year-old, so I really did not want to be, or I did then. Yeah. She's older now, but I really didn't want to be stuck in Paris. And then this sort of thought that when I came back, I had a kind of sense of being out of time in terms of everybody else's reactions, because I had to come back and quarantine and self-isolate in my house to make sure that I hadn't picked up anything on the flight. So it was really, I think, very dramatic. And I know that other people's experience of the pandemic was also dramatic, but going home from work and staying home is a little different from, having to rush to a flight.
It's, that's interesting, because culturally and even distance-wise by plane, not that far, you wouldn't think, Paris to be so different, but what you're describing is, were the conditions quite different? Like even what the requirements were in France versus coming to the US at that time?
Well, it was spreading more rapidly. I mean, now we know that it was also in Boston, but at the time, all the numbers were suggesting that in France, there were pockets that people were tracking. And so the numbers looked like they were rising astronomically. Now they look very small, but at the time they were really alarming. And so, even though I know that the travel ban was as much political as anything else, it did feel like I had maybe done something a little bit riskier than I imagined at the time. But nobody really knew, because we didn't have good testing, so it was hard to know where things were.
Even that, just reading that story about Canada and the detail in there about Canada's lack of testing. And I think, because we've focused on the other parts of the pandemic now, to recapture that time, it seems to have slipped people's mind a little bit that people literally couldn't get a test.
No. Yeah.
And so if you wanted to know, you just couldn't. It's so
Right.
jarring to remember that terror that I think a lot of people experience, and
Yeah.
I hate
There was
that we've kind of lost that.
Yeah, there was a woman coughing in my row, and I asked whether or not, someone could give her a mask or something, and she glared at me and said, "I don't have COVID." And I just, I think now we'd be horrified by that, but she just, had an assumption about herself that that she wasn't contagious.
Yeah.
And so, yeah, I think absolutely there was just so little knowledge.
The great American talent for self-diagnosis right
She was,
there in the
she was
in the row.
French.
Oh, okay. All right. Fair enough. So I want to ask you about your book, your recent book, The Medical Imagination, Literature and Health in the Early United States, and hear about that project, to then foreground kind of how you started to make sense of COVID, and we'll talk about the relationship between that book and this time. But can we start by talking about the book?
Yeah. So the medical imagination is really about trying to think about ways of knowing and the way that medical knowledge was produced between the American Revolution and the Civil War. And part of what I was interested in at the time was thinking about a period in medical history where people think, well, nothing much happened, or what did happen was really just a kind of floundering and a proliferation of other forms of medical knowledge because medicine was so inept. And I don't think that's a retrospective view that I don't think is particularly helpful. And so I became interested in thinking about moments of what I called in the book epistemic crisis. So moments when things happen that really make people confront the fact that they don't have complete ways of knowing or understanding a situation, where they're grappling to try to think through and imagine. And at the time, people used literary forms, I argue in the book, and were really, forced to be much more imaginative because their available ways of knowing failed in the face of a kind of crisis. So the two contagious disease crises that I talk about in the book are the yellow fever epidemics of the 1790s and the cholera pandemics that began, at least in the Western world, in the 1830s.
And say a little bit more, if you would, about the 1790s. So I know the Philadelphia case. Maybe there were other instances of yellow fever in the United States in the 1790s. But one thing, about the uncertainty in Philadelphia is it wasn't, as you say, it wasn't for lack of medical bureaucracy and infrastructure. There were hospitals there. There was medical education there. It was a center of American medical practice. The doctors are constantly fighting with each other, which itself became a source of literary contemplation and poetry and writing about even the doctors. So it's not like it was a place without knowledge makers, but even they were engaged in sort of producing some forms of uncertainty.
Absolutely, yeah. In fact, yellow fever, there were outbreaks of yellow fever all up and down the eastern seaboard. And Cristobal Silva and Catherine Arner have talked a bit about the way in which it really was a kind of Atlantic epidemic. It wasn't, we think of it as happening in Philadelphia because it disrupted the functioning of the US government, but it also happened in New York and Baltimore and the Caribbean.
Mm-hmm.
I think what is different about the 1790s epidemic, as opposed to cholera, which I think actually bears a bit more relation to our current pandemic, is that yellow fever was something that people knew about. They didn't know they didn't know how it was transmitted. They did all kinds of experiments to try to figure things out. There's one great story about this guy, Stubbins Firth, who tries to prove it's not contagious by taking the black vomit that was a signal symptom of yellow fever and eating it, putting it in his nose, putting it in his eye. He cuts himself and just to show that, in fact, it's not contagious. And now we know that it's transmitted by mosquitoes. But cholera, that was a trying to figure out of something that had sort of new resonances in the 1790s context. Cholera was a totally new disease. And so I think in that sense, a lot of the kind of early thinking around COVID really resembles the early thinking around cholera. Insofar as, doctor friends of mine would say things like, "Oh, it's a coronavirus. It's just like the cold, right? Coronavirus is a category that we check off on our forms."
Right.
Yeah, and the same was true about cholera. People thought diarrhea is something that we know about. This is just a worse form for whatever reason. And then it only became sort of clear over time that it, in fact, was kind of categorically different. But that was a tension that I think is really resonant with today.
Can you say a little bit more about the kinds of sources that you rely on for this to sort of sketch out what is at hand for making this imagination?
Yeah, so I'm interested in medical sources, but the medical sources actually are full of literary flourishes and thinking about what Shakespeare had to say about that time.
Oh, really?
I'm
Hmm.
also, yeah, oh yeah, there's actually a moment in Benjamin Rush where he says, Shakespeare said this better than I do when he offers 4 lines, from Macbeth, and that's about a different kind of condition. But I was really interested in those kinds of literary flourishes, and I was interested in how genres specifically, which is to say the kind of shape of the narrative, the different shapes of narratives actually make different kinds of knowledge possible. And so I became very interested in how the Gothic, in particular, I think, which was a relatively new genre in the late 18th century, becomes really a form for global health and thinking through global health, because one thing that it really offers is a kind of dwelling in uncertainty, but also a sense that that the world that can be suddenly defamiliarized, and it really helps people navigate that. But people used all kinds of genres to think about this, and so I was really interested in the kinds of uses of literary genre in medical text, and in popular culture, to try to think through some of these problems in ways that traditional medical, what we think of now as sort of traditional medical forms, really have a hard time dealing with.
So is it that doctors are well read at that time? I mean, that doctors are actually engaged in reading a lot of producing literature, reading literature, or is it that the sort of just the sense making is happening outside of medicine, and people are turning to just all manner of types of accounts to explain, including, I'm assuming, biblical and other religious texts, to make sense of what's happening to them, and not worrying so much about what the official medical pronouncement might look like?
Yeah, I think it's happening more generally throughout the period, not only in moments of crisis. I chose the
Hmm.
moments of crisis because I think that they're particularly illustrative of
Hmm.
of that kind of work, because suddenly there's an urgency to them. But doctors are particularly well read at the time, and in fact, that really part of the profession was, especially for elite physicians, was showing how erudite they are. Benjamin Rush, most famous physician in American medicine for about 100 years, says at one point that he thinks that that the act of writing poetry, of putting words next to each other and seeing how they fit, is, in his words, exactly the same as medical judgment. And so he really encouraged doctors to write poetry, and you would be surprised how many bad bad physician poets there are in the first half of the 19th century. It's really a part of the profession, and that goes back actually to ancient Greece. Apollo is the god of both medicine and poetry, so there's a long, long history of that kind of relationship.
I sense a future anthology in the making here. Bad medical poetry, perhaps.
No one wants to read it.
I do.
So bad.
uh,
And but
um,
in part it's so bad because part of it was about illustrating how good they were at the form. So it's very formulaic. You have these
mm,
rhyming couplets, and everything is about really tightly controlling things. That's not what we value in poetry anymore.
that's so interesting, though a commitment to sort of demonstrating that the forms could be, that a person could use those forms, which is, I guess, not that different, as you're saying, Rush, wanting to demonstrate that doctors can think analytically, and I think medical, record keeping. There's many other kinds of genres, I guess, that are sort of emerging at that time, which are very formal, right?
Mhm. Yeah, and so poetry was a way of really demonstrating the command of your mind.
And just one more thing about this, that you mentioned the Gothic. So I mean, we're thinking about like Poe here, right? I mean, who are some of the authors that we should have in mind at this period, that's sort of out and about, and during the time of the cholera epidemic, for example?
Yeah, Poe is really, I think the best example of somebody who's really thinking about cholera. Cholera is weirdly kind of subterranean in the Gothic writing. In part, I think I've written actually a little bit about this. Cholera's signal symptoms were so disgusting that people didn't often write about it directly, because when people vomit and defecate themselves to death, right? That's not really that's hard to depict, I think, in the genres that were available at the time. So you end up with these sort of side descriptions. But Harriet Beecher Stowe actually, she has a novel Dread, and that has really Gothic depictions of cholera as well. And Stowe lost one of her sons to cholera quite quickly, and so and one of her other sons says that that's actually the impetus for Uncle Tom's Cabin. So yeah, so I think it's sort of subterranean. Yeah.
So the Mask of the Red Death is about cholera, maybe?
Yes, it is about cholera. I think, in part because, and this is a little bit around the margins, but as I was sort of suggesting, right, there's a way in which a lot of the writing had to go the long way to kind of discuss cholera, but the Black Death doesn't actually become a site of interest until cholera. It was kind of obscure. And then suddenly people become interested in this historical pandemic as a way of trying to explain what's happening in cholera. They don't know whether or not it's actually the same. They were both quote unquote Asiatic diseases that had come from Asia, and that were new, that were quite devastating. And so the Mask of the Red Death, which is kind of a fictionalization of the Black Death, there are a lot of hints in the story that it's actually a story about cholera.
That's really fascinating. So there, in the storehouse of pandemic history, there wasn't a lot there for authors in the 19th century for them to choose from if they wanted to find a reference point. They had to really search out a little bit.
I don't know that they had to, search all that far, but the Black Death, it just hadn't been as spectacular a kind of history until that moment. But it had enough resonances. I mean, I think they had other touch points that they could have used, but because the Black Death felt to them as sort of large in scope, as fatal, and as similar to cholera, that became a kind of touch point. And it is that moment that in which the Black Death really becomes part of medical historiography, and in a way in which it had not before.
And Lenore in The Raven, is she also a victim of cholera?
I hadn't thought about it that way, but I should go back and look.
I just, as you were talking, I was like, I kept trying to remember if there's any clues, but I can't remember.
I do actually think, and I've argued that in the Fall of the House of Usher, that the Fall of the House of Usher is a kind of theorization of cholera.
Wow.
Yeah. So Poe offers this theory that it's that cholera is actually caused by fungus, that then gets taken up in the medical literature for a few years. He's quite close with this physician who writes about it. There's some international arguments about whether or not who's actually discovered it, but I think actually the answer is Poe did. But of course, the reality is that cholera is waterborne.
Okay, I promise we'll move on. I won't ask you every bad thing that happens in a Poe story. Was it cholera? But I'd love to know that, actually. I think that's really fascinating.
He actually writes also The Sphinx is a story directly about cholera, and it's a story a bit about self-isolation and quarantine. He leaves New York during a cholera pandemic and flees to the countryside, but is sort of unsure whether or not cholera is coming to get him.
COVID calls listeners who are putting their summer reading lists together, just putting Poe back on the list. They might have taken Poe off the list last year when they moved through their Gothic lists, and we'll come to that, I think, in a minute. Get Poe back on that list. Just a quick reminder, you're listening to COVID Calls. I'm talking to Sari Altschuler about literature and the medical imagination in COVID-19. So let's turn to COVID. I want to read, you published a really great Washington Post piece, assuming it's in the Made by History series, such a great collection of articles. And this was pretty early on in the American experience of the pandemic. You wrote, I'm just going to read a couple lines here. To deal with such uncertainty, so you foreground it talking about medical uncertainty. To deal with such uncertainty, we might look to writing from the cholera pandemics to make sense of our own anxieties our own uncertainties swell, exacerbated by our unpredictable president, hidden medical information, and failures of testing. We fear the political, social, cultural, and economic unknowns, you write, but we can look to historical pandemics to learn that they are precisely that, unknowns. So I thought that was really also a time capsule of a particular moment in time when this piece appeared. So itself has become a kind of a historical reference point for me. And I wonder if you'd just say a little bit more, maybe to extend your argument there about how people can look to these previous eras or previous pandemics, in this case, quite distantly removed in time, to make sense of not knowing, make sense of uncertainty.
Yeah, I mean, I think what's useful about, especially about the 19th century cholera pandemics, is that they were events that people lived with for a very long time, and so there really was a kind of development of literary form around them, ways of trying to describe experience, and I think that's really what people lacked early in the pandemic, was a way of describing what was happening. So in that sense, I think these stories can be resources for us. And it's worth noting that even the Poe stories, and I mentioned Harriet Beecher Stowe, they're not writing about cholera until years, decades past the first appearance of cholera. So there really is, I think, the development of a way of talking and thinking about what it's like to live with a pandemic that we really could stand to learn from. And that's different from the position that we found ourselves in. And in some sense, I think the mid-19th century is a great touch point for this, because after that, we have the professionalization of medicine and the rise of the rise of the medical profession, a kind of confidence in our ability to deal with microbes that we then, I feel like, we suddenly lost with the COVID pandemic, right? Viruses, we thought we knew how to deal with. Well, experts did not think that we knew how to deal with them, but other people, lay people wandering around, did have, I think, a great deal of faith in the medical profession to try to control things. And that's, I would argue, a very generically driven faith that comes out of what Priscilla Wald calls the outbreak narrative. We just think that we thought that the scientists really would save us. And so going back to the mid-19th century, I think, is actually quite useful, because it's a moment in which people really discovered that the medical profession couldn't necessarily save them, and it was quite devastating. Oh, I can't hear you.
Sorry about that. Just to linger on that for a second, I don't find that particularly, I find it fascinating, but also not that comforting in a sense, or maybe comfort isn't the right word, and maybe we shouldn't be looking for comfort in the middle of a pandemic. We're just looking to somehow make sense of things. But this point you're making, that that we're going to have to linger with some uncertainty, that the medical profession is not there to give every answer as if the pandemic is a math problem. It is scary. I mean, even as we just talk about it now, to watch doctors dispute the president of the United States in public on TV is deeply unsettling. So just to, like, for an example like that, how can the medical imagination sort of be filled in or be useful in a moment like that, with Tony Fauci standing at the dais and the president of the United States saying, we're going to use this untested medicine, and Fauci's over there just kind of shaking his head. I mean, that's a really just disturbing moment. How can literature help fill in there, or what's the use of it in that specific kind of moment?
Yeah, I mean, I think in one sense, it's true that that's quite unsettling, but we live for a kind of narrative completion that is always a kind of fiction. Our desire to have the story be done, to know how the story is going to go, it is, I think, a deeply human desire, but it's also one that is always a kind of falsehood. And so that's not an optimistic reading of things, but I think I think that understanding a little bit about what our narrative forms have actually facilitated and also what they have foreclosed is really important. So suddenly I feel like we had to reckon with the fact that the outbreak narrative, Priscilla Wald does a great job of talking about, how it works, that something comes from a developing nation with a population that's marked as expendable, and it comes into uh, in the case of the United States, right, a sort of white Western space. It threatens that's quote unquote civilization, and but then the doctors come and they save us. And I think that one thing that you're seeing in that moment is narrative failure. And so I think just attending to the shape of narrative in that case is actually really really helpful in helping us see everything that was foreclosed by our investment in that narrative. And so that's not a super helpful thing to say, but my when I was talking a bit about dwelling in uncertainty and that the Gothic actually lets you do things like that, one positive thing is that if you're uncertain, then you don't actually know how the story is going to go, and that's both bad and it can be good. And I think in the United States, actually, we've seen the ways in which it can be good. My own sense is that, for example, the kind of changing discourse around racial justice and social justice more generally in the United States, I think that is an effect of the pandemic. I think it's an effect of other things as well, but early on. At least the discourse that was circulating had to do with twin pandemics, that these were sort of one pandemic. I don't think that you would have the president in his first 15 minutes of office talking about white supremacy and systemic racism without the pandemic. So I do think that there are kind of narrative twists and turns that have to do with the rupture of narrative expectation that have actually been really productive.
Do you think that Americans, and I would just focus on the United States for a second, we have watched so many films, read so many books that do have this kind of a neat and tidy narrative completion. I mean, I think of my childhood absorbed by watching, crime procedurals and medical shows, and sitcoms where it can get pretty complicated in the first 5 minutes and then it all gets resolved. I mean, was I programming myself to think that the pandemic was going to end in 26 minutes?
I mean, I think that would depend on how much you had invested in it, right? But
Yeah.
but they do a very particular kind of work, and especially in those shows, they often have actually one episode that's about an outbreak, and it follows this really predictable trajectory. And one thing that was interesting to me actually going through this was how much people remained invested in the outbreak narrative, and that this was just a playing out of the outbreak narrative, even as we entered a pandemic. And I would say that's absolutely not the case. That there was a kind of epistemic crisis, that people really were floundering for other kinds of stories, even as they maybe used some of the language of the outbreak narrative. I would say, as a huge fan of procedurals, that they're extremely comforting. And I don't think that when you watch, a detective show and the body drops at like minute 5 and the second body drops at minute 45 or whatever, depending on the show that you watch, I don't think that you necessarily really think that's how the world works. Although, people do argue that that's a kind of programming, but we seek out narratives for comfort. Very little actually wholly fits into a narrative form. Life is much more messy than that. And so I think that it's more about saying we use these narratives to understand what's going on in the world. And that really facilitates some extremely important work. I'm not saying the outbreak narrative is all bad. It's actually, as Priscilla Wald says, like it is actually extremely useful for public health. But it necessarily forecloses other kinds of thinking. And so just being aware that you're always telling a story about something that does certain kinds of work and forecloses other kinds of work is, I think, itself part of a kind of urgent realization that's come to the fore because of the pandemic.
I'm really appreciating this conversation in that moment in time where those who had the option to lock down, for example, around the world who were not essential workers and going out every day and putting their lives on the line. But the great majority of us who followed public health, prescription and stayed home, a lot of the time, even though we were working and dealing with childcare and everything else, people did turn to entertainment. They turned to fiction. And I haven't, early last year I looked, I mean, the number of book sales went up, obviously downloads, Netflix and all that went crazy. So March of 2020 it was a great moment of choosing, I guess. I hadn't thought about it this way till talking with you about the kind of literary forms that people were going to plug in to try to make sense of what was going on in the world. This is like, I'm treating this like it's some big, you've been thinking about this for months, and this is really finally coming through to me that's a lot of what we were doing is like, well, are people going to rely on, well, I'm going to ask you, what were people turning to?
Yeah, I mean, I think obviously people were turning to stories about past pandemics. So I myself also took Love in the Time of Cholera off my shelf and started thinking about and rereading Poe. But I think that, part of what was really interesting to me was some of the less expected forms. So one thing I got really interested in, it's going to sound a little bit funny, but in the US context, at least, there was a moment in March and April where everybody was talking about Groundhog Day. Everything was Groundhog Day. And I mean that not just like people at home who did not have COVID and felt like every day was the same, but also, essential workers were talking about it like it felt like Groundhog Day. And epidemiologists were saying that the sort of failures in serology testing, this is Michael Mina at Harvard, said that it was Groundhog Day all the time. And people who had COVID said that the disease felt like Groundhog Day. And that's, I think, what made it so powerful. That's the genre. That genre is called the time loop. And the time loop became such a powerful way for about 2 months of understanding the pandemic. In part, I think, because it bore such a close resemblance to the experience of the disease itself. So, and the sense of recursion that comes with waves and other kinds of, a genre that really helps you think through what it's like to have repeated experiences without a sense of when they might end. It's actually much darker than Groundhog Day is much darker than people think it is. But it's also lighter than other kinds of time loops. I was thinking at the time, Russian Doll was another really popular time loop that was available to people, but it was about somebody. It was a much darker version of the time loop. And so it was interesting to me that people really wanted something lighter. They wanted to think that their experience was kind of narratable in a Bill Murray comedy rather than some other kind of meditation on endless repeating.
I watched, having not seen it in many years, I watched Groundhog Day with my children during the pandemic, and we actually did it. I mean, this would be a total, this is emblematic of that time. We did it as I forget the term you used, but you watch it simultaneously with other people who are friends, distant, so we're having this experience of Groundhog Day. And it's a really dark film. And he's, what's happening there, and I wonder about the impact on people making sense of the pandemic. I hadn't thought about it quite this way, but he's trying to really confront his failures as a person, one by one, how he takes his relationships for granted, how he's not happy with his work, how he has unfulfilled possibilities. And as you're watching it, you're like, wow, he's like taking on and then you're like, what am I doing tomorrow? I mean, there's this strange, interplay of that. But of course, then it ends. He breaks free of it somehow.
But that is what people were doing at the time too, right? Thinking that they should use the time to become a better person. They were going to take up baking and do yoga, So I think it really struck a chord. But it is positive at the end. But it's positive in a way that I think is actually almost unsustainable for the movie. You can tell I've thought quite a bit about it. So the end takes these two career-minded individuals, and they fall in love, and that breaks the spell. And then they decide to maybe get a house and get married and live in a small town, which is basically this fantasy about returning to the 1950s, right? And so in that sense, it's a very comforting and also like discomforting depending on your perspective view, but the movie almost can't even sustain it. At the end, they have this long kiss, and the last, and he says like, let's move here. They kiss for like 3 seconds, and then he turns to her and he says, we'll rent to start. And I love that, because it's this, like, he knows that it's unsustainable. The movie knows it's unsustainable.
I hadn't thought of it in that meta way. Maybe it's a sort of a statement on American society more generally becoming too wrapped up in work and forgetting itself, and just living every day as if, you're just sort of walking through it, sleepwalking through it, and then you break through. I hadn't quite processed it that way. There must be a lot of people reaching out to you for reading lists during that time. I know I got a lot of requests. What kind of history? And history, I'm going to get in trouble with my historical colleagues here. We don't make things up. History is based in evidence, but there's a lot of imagination that goes into imagining the past. And so, as you go back and read those pandemic histories, you find that too. So I was making suggestions and reading a lot of works that were suggested to me of pandemic history. You must have been fielding a lot of requests for literary accompaniments to the time we were living in.
Yeah, I mean, I in part, I think I forestalled that a bit. My colleague and I, Elizabeth Maddock Dillon, we created this humanities coronavirus syllabus that was itself an attempt to kind of address that. Actually, I got her email when I was on that flight from Paris, so about an extremely specific sense of how and when it started. But yeah, I mean, I think people are seeking different kinds of ways of making sense of this. The question about what to read is as much about, do you want to sort of understand this, or do you want an escape from it? And so, you talked about procedurals. I think I think probably cop procedurals are going to be not so popular for a while, but certainly other kinds of detective procedurals, but especially historical fiction. I mean, I think so. People certainly do want to read about accounts, of epidemics and pandemics in the past, and how people dealt with them and how they negotiated. But I think also people wanted an escape from that, something that sort of took them out of the kind of relentless crisis of the present.
One thing I was happy is that people still asked. And I thought that was kind of an interesting feature of the pandemic. And I'm thinking about the history here, because all you got to do is go into Amazon or any other search engine, and the AI will tell you what to read about the past, what sort of forms of imagination you're going to package in there. But there was still a lot of, and people, I guess, had time to make calls and reach out to reconnect. And making book suggestions is a part of sociability that I saw emerging in the pandemic that I had. I mean, it's always sort of there, sort of book club culture is always sort of there, but it seemed like the whole country now got immersed in this sort of book club culture.
Yeah. Yeah. I mean, it's easy, I think, to look back and almost romanticize that,
Yeah.
But to remember that living through crises is never, as interesting as it was to actually to be there at the moment is, yeah.
Can you say a little bit about the syllabus, the humanities in the time of coronavirus syllabus?
Yeah, as you were saying, I think people were really looking for resources to make sense of things, in part because all of a sudden something was happening that people had imagined because of the outbreak narrative was part of the past. I think since the 1970s, people really thought that these kinds of outbreaks were things that existed only in the developing world, that only existed, and that had only existed in the past. And suddenly they were confronted with that kind of terror up close. And so we just wanted, we knew that at the same time, Alondra Nelson was creating her own syllabus, but that also included, a lot of social sciences and other kinds of reading. And so we thought the humanities have a really particular perspective to share, and it's different from readings in the natural and social sciences. And so we really wanted to give people a sense of the rich resources that philosophers and historians and art historians and film critics and literary scholars had to offer to kind of make sense of things. And I think, as you're saying, right, the humanities and the arts actually seemed extremely important and pressing in this time of unknowing, as had been the case in, as I was arguing in the 19th century. But suddenly people thought, oh, actually, the natural sciences don't have all of the answers, or medicine doesn't have all of the answers, health professions.
So let's talk in a little bit more granular detail about different points in the pandemic. Were you noticing different genre choices I really like the way you're talking about how Groundhog Day becomes a sort of term of art in public health. I mean, that's really fascinating because it's there and it's a reference point and people can use it. And it stands in for a lot. I mean, the metaphors do a lot of work for us in society, particularly when we're trying to communicate under stress with limited time. You see some changes over time, even in the kind of metaphors or descriptive language that the news media use, or people's own choices of the kinds of narratives they want to tell about the pandemic, say from the spring as we go into last fall?
Yeah, I mean, before Groundhog Day, you had all of these sort of apocalyptic narratives. That's part of the outbreak narrative, but there was a sense of dwelling that maybe the apocalypse wasn't going to end. And so that was a really, I think, vibrant way of talking about the pandemic in February into early March, and mid March. Then I think you have the time loop, and then out of that, I do actually think that the Gothic began to reemerge as a kind of way of thinking about the pandemic. I remember reading an article in the LA Times that was talking about how the way that COVID works and that SARS-CoV-2 works in your body is that it sort of transfigures your cells into zombie cells.
Mhm.
And I read also an article in the Times about about the kind of time lapse between what you can know about that COVID is always there before you know it is, even if you have the best testing in the world, because of the lags between, when you get infected, when it can show up on a test, how long it takes to get the test back. You're talking about a week time lag. And so they were talking about sort of hidden infections, and they didn't know where it was going to go next, and it had this really Gothic sensibility about it. So I think, early on, certainly people were talking about Mask of the Red Death and the Gothic, but I actually think the Gothic has been a consistent thread through the pandemic into the fall, as things got bad again, because the Gothic is really good at talking through what it's like to be caught. If you think about the sort of classic 18th century Gothic novels where it's a woman caught in a castle and she can't escape the horrors that are happening, and they're different but they feel the same, and there was, I think, that sort of sense of recursive horror. One thing I will say that really struck me and I found very humbling was the emergence of Black narratives in the US about the pandemic, and those, to me, I felt very humbled by them because whether it was in the Times, people talking about how the way that COVID was moving was really about slavery, or thinking about the kind of familiarity of COVID.
Mm-hmm.
That seemed very different to me than I think that a lot of the narratives I've been describing are really white narratives, and that there was a realization in the Black community that, in fact, this was very familiar. It was a different disaster, but again, it was going to disproportionately affect Black people who were going to be left to bear the burdens of the disaster. And I felt really chastened, like, oh, here I am thinking about Groundhog Day, and the African American community is like, this isn't new, like,
Right.
this is, yes, the structural horrors of slavery slavery continues to structure American experience, no matter what, like, the particular topic itself is.
The obituary, which is it's not unique to the United States, but it's such a feature of United States newspaper culture. And obituaries have become maybe almost in some ways the dominant literary genre of this time. And I've talked about them on COVID calls with other guests, but I'm curious what you think about obituaries. I mean, now sort of dominating sort of lists of names with photos, and then going inside to find these recurrent series in every major daily newspaper in the United States, I think, has had a series of obituaries. I think about that, and then to connect that to your previous point, the obituary of George Floyd, which is, I think, probably one of the most widely read documents of this time as well. And it is not as you say, it's not a narrative. I mean, there's closure to it, but it doesn't fit in with a sort of Hollywood depiction of how bad things are gonna end. The story is uncertain, and it's hard to read, and then it ends in the way that we know it ends. And so I wonder sort of a little bit more about how those kinds of stories, life and death stories of individuals, factor into this.
Yeah, I mean, one thing that I think was really interesting was around the 100,000 death mark in the United States. There were attempts to kind of think about the obituaries as data, but also to render the data personal. And so, I mean, I think one of the things that's interesting about obituaries is that there's just this relentless attempt to make individual to as actually I think the story that you read at the beginning about the Canadian experience of COVID. There's a relentless attempt to try to make the numbers mean something, and the obituaries do, I think, a lot of that work by really returning the individuals to the story. At the Boston Globe certainly had its own version of trying to think about, and the New York Times trying to think about what the number 100,000 means. And so, yeah, I mean, I think that it's a difficulty in a situation like this. How do you honor the individual life, even while you're overwhelmed by the numbers? And it doesn't have there's no easy answer. So obituaries are in some ways quite formulaic, and in their sort of overwhelming accumulation, both offer individuation, but also I think turn into data in a way that can be discomforting.
I wonder, just thinking about the use. I don't even know how to talk about this. The use of obituary. I mean, it's got me thinking about some of the limits of what can be described in the middle of a pandemic. So it's interesting analysis of a problem of obituaries. So this is before the pandemic, but of people who die of opioid addiction,
Right.
and the convention of obituary around opioid addiction, and the problem of talking about it. And so what can and can't go into an obituary. And I've thought a lot about that as a sort of broader metaphor for our time. And what I mean by that is that you probably had this experience too. Somebody will relate to you something very human. My brother got married, or something good happened at work. And then there's this sort of caveat. They say, I feel weird talking about that right now. Or I don't, or something bad happens to them, but not terrible. Like
Mhm.
I broke my arm, but I don't have COVID. And I wonder, I've been trying to think about ways to even conceptualize this or talk about this, and it may be another place where we have to go beyond the data and reach for some imagination and some literary forms to help us. But we do feel a little bit confined in what we can say in the midst of a pandemic.
Mhm. Yeah, I mean, I think that's true because the overriding narrative is about the pandemic itself. So,
Right.
so having any other kind of narrative experience within it becomes uncomfortable, if there isn't a kind of meaning making within the pandemic, right? Oh, I'm doing this as a way of demonstrating that life continues during a pandemic, or I think if you can fit it in that way, then it seems really comfortable. But having a sort of separate experience seems so difficult. I mean, I personally have known a number of people who have died since October, and a sort of shocking number, and none of them from COVID. And just trying to think about how to talk about that, or how to make sense of it is really has been, as you say, very difficult. How do you talk about sort of seemingly or really tragic deaths in the midst of something else that seems to really like kind of hijack the narrative completely? It's really, I mean, I will say, and this is, I think, one way of thinking about this. Long ago, I thought a lot about how in biography, it's very hard to talk about the body. Body just kind of doesn't fit in biography. Either you're writing a pathography, like a story of a disease, or it's a line, right? Like, but it's very
I
hard to talk about how about things that happen to the body if you're talking about anything else. And so I think this is a kind of extension of that, right? Like it's hard to talk about anything else as you're talking about the pandemic, because disease, it just doesn't fit all that well into other kinds of narratives.
But I wonder, I mean, is there some literature that we can turn to for that? And I think of genres of, and I've been resistant to the war metaphors that saturate our time, but here goes, that people who've written about sort of daily life in wartime, not at the front.
Mm-hmm.
And I felt like maybe that's something we can turn to at this time, to try to just develop some ways that people can talk about their normal everyday experiences. Some of them might even be medical. Many of them might be medical and traumatic, but not COVID.
Right.
When COVID is the dominant frame, the dominant sort of disaster frame that we're running with, but there's a lot happening underneath that doesn't fit in that.
Yeah, and I think, for a while that seemed extremely risky. I was personally worried
Sure.
that, for example, the political crisis that we were also experiencing, that was not, in the US, which was not COVID related specifically, that people would not be able to think about both things at once. That especially the stopped time feeling of COVID, in the time loop, right? That you would get stuck so much in the experience of COVID or whatever it is that was happening, that it would become very hard to think about the fact that other very serious things are happening at the same time. I don't know the answer. I think we have a hard time. I think because that narrative pull is so strong, we have a hard time talking about it. But when you think about other kinds of experiences during war, when we talk about, for example, literature produced during the Civil War, we think about things that were about the war or studiously about home during the war. It's really hard to think about literature that, didn't have anything to do with the war. And that's, I think, just a kind of coping mechanism, or a brain structure or something. I'm not sure exactly why it is that that's true.
The other kinds of metaphors that you've seen people turn to throughout COVID, I mean, beyond war, battles in the front and the virus as mounting its attack and all this kind of thing. I mean, that's at hand. We've always lived in a militaristic country, so those metaphors do a lot of work for us, even when everything is going along just fine. What are some of the other uses of language that you've been paying attention to?
Yeah, so I've been really interested in the wave metaphors, in the attempts in last June to kind of think about a forest fire instead of a wave. Actually, David Jones has a great piece in the Boston Review about the shape of pandemics. But one thing that I became kind of interested in about the wave and the forest fire as metaphors. First of all, they are all about the outbreak narrative. It's all about trying to conjure a sense of urgency, something that's almost that's above the human, but that's natural, that needs to be combated. So I think, I became really interested in those metaphors, in part because, again, of what they obscure. The wave metaphor, they're seemingly natural, but the pandemic, of course, it's part of nature and humans are part of nature, but it really was generated by human action, and so and propagated by human action, and you got some sense, I think, in this sort of like flattening the curve, that there was a call to kind of do something about it. I think the forest fire metaphor was actually also about trying to conjure some sense of individual responsibility. But one thing that I thought was so interesting about it was that I hate to use the word interesting when it's quite devastating, but these are the literal forces of climate change. So, how is it that we're using these metaphors to talk about the horrors of something that then in their reality, in terms of climate change, we actually can't see them as horrors and disasters. It just seemed that the sort of confluence of those things, of people who, sometimes are kept inside their houses because of COVID, but also because of the smoke coming from from the fires that are raging in the mountains in California, and who then are experiencing these kind of brownouts. So then they're being forced out of their homes at the very moment at which they're being told to stay in them. I think those are those moments where the waves and forest fires, where the kind of literal and the metaphorical meet in these really uncomfortable ways. And I, it's probably too much to hope that people will see that the kind of the friction there. But it seemed to me so uncanny to think about the actual waves and forest fires that threaten people's lives that can't be seen at the scale that they really at the scale that they really are, at the same time as people are using them as metaphors to try to suggest scale and magnitude.
Did you see much experimentation in the use of language? I mean, did you see descriptions? I mean, I think of you as a person who's probably consuming media about the pandemic, and you're reading for things that other people are not paying as close attention to. Were people taking risks? Were there certain news media or other artists who are out there and describing the pandemic in uncomfortable or strange to us ways that don't fit into these metaphorical conventions that grabbed your attention? And I'll give one example, although it's only come out recently. I'm making my way through this. The comedian Bo Burnham has this new piece, this Netflix special called Inside, and it's gotten kind of, it's an interesting piece, and I don't know if people have watched it yet, but it's a meditation on the ways that a lot of the thinking about the pandemic is very formulaic. And then in various moments in the piece, he tries to break free of it entirely and talk about other things that are running through the pandemic, media conglomeration, for example. And I thought, and it's interesting in that regard because he's trying to change the conversation about certain things. I don't know how successful he will be as one person, but I thought, well, this is an attempt to get beyond the sort of metaphorical strictures that we've been trapped in a bit.
Yeah, that's fantastic. I mean, I think I maybe more was looking for the ways in which the forms were being used repeatedly, but with difference. So maybe I was actually seeking out the opposite. Yeah, I mean, I think that, one of the things that interests me is the ways that people are unaware of how language is actually giving shape to their ideas and the ways that they communicate things. That example I used before about Michael Mina using Groundhog Day as a way of talking about serology testing is a moment in which people aren't thinking about how the narrative and metaphorical forces that are really like kind of at the cultural level, not at the individual level, are shaping the way that they're understanding experience and in turn shape action. So I guess that's what I was a little bit more interested in. Although I will have to keep an eye out for people kind of experimenting.
Almost up on time in my conversation today with Sari Altschuler about the literary imagination, the medical imagination, and COVID-19. And I wanted to just get to a couple other quick things. One is, you have written about the need for the humanities to play a stronger role in medical education. And I'll put a link up for the piece that you've written about this. You argue that the uses of the humanities in medical education, and I wonder if by extension STEM education more generally, it goes beyond sort of what you call instilling empathy, that it has a role to play that goes beyond just, I don't know how else to say this, but like turning doctors into human beings, which makes a lot of bad assumptions about doctors to begin with. But I am sort of curious, like, how you find your way into this discourse about medical education.
Yeah, I mean, I hope that the conversation that we've had is really illustrative of the kinds of things that the humanities do. I mean, I actually think that I often joke that people who think that reading more books makes you more empathetic have never been to a faculty meeting. Because it turns out, right? I mean, yeah, I don't have a lot of faith in the idea that that's actually what the humanities do. I think instead, what the humanities are really good at is, for example, showing you the way that narrative is actually shaping the way that you're thinking about things, or showing you what the historical precedents are that you really would be that it would be worth your while to know before you undertake particular kinds of decisions about public health, about global health, right? Oh, well, how did that work before when we tried that kind of thing? Or the kind of ethical ramifications of particular kinds of choices. I mean, I think you can think about techno-optimism, right? Like, okay, like we have these narratives about how technology is good and going to solve all of our problems, but actually, right, it really blinds us to a lot of the kind of ethical concerns that we would be better suited thinking about in advance before people are harmed, and then we need to think about them. But that's not really how, for example, health technology works. And so, yeah, I mean, I am a strong believer in the humanities. The issue has been that because the humanities are not great in terms of fitting into the kind of quantitative analysis that STEM often relies on, then suddenly it seems like people make the argument, oh, the humanities are not valuable because of that, because you can't show me in a graph what the humanities do. And the answer is that the humanities actually is a set of tools that are complementary to the analytical tools of, for example, evidence-based medicine, but they do something different. So trying to evaluate them in that way is actually kind of a fool's errand. That's not what they do. And so they can't really be evaluated in that way in any meaningful way. So yeah, I hope that people think a little bit more seriously about the kinds of analytical tools that the humanities offer. And hopefully some of the examples we've talked about are useful in that way.
Absolutely. I think in my discussions with colleagues who are in medical education or in engineering education, or like the institutions I've worked at, I've rarely had anyone, I can't think of ever had anybody say, oh, I have no use for history, or I have no use for literature. It's always a time issue. It's always, I just don't have time, or in my education, every single hour was taken up. And so we just didn't have time to do that. So, or another way of saying it is, the last time I read a book of history was in high school, and I didn't realize it was going to be a value to me. So in some ways, this feels like a battle for the curriculum. And the
Yeah.
humanities we haven't totally lost that battle, but it's a losing battle, at least in the last few years in the United States. How do we turn that around? I mean, I don't ask you to speak for the entire medical profession and curriculum, but still, are there ways to make some inroads in this discussion?
Well, I kind of had hoped, and that COVID was one moment where that might be possible. Suddenly, for example, in medical schools, they were asking people who teach narrative medicine and history of medicine to teach more, right? In the manifest, illustration of the failure of medical knowledge in other ways, I think it became clear that people were really searching for something else.
So just a last little small question for you. Are we going to see a COVID genre? Is there something?
I don't think so. I think
No?
we're going to see, people turning back to some of the historical genres. I think those things take a really long time to emerge. So if we do, I think it'll be 20 years from now.
Just a reminder that you've been listening to COVID Calls, and you can catch COVID Calls most weekdays at 5:30 p.m. Eastern Time. And I want to thank my guest, Sari Altschuler, for wide-ranging, really interesting conversation today, and really appreciate the thinking you're doing and the writing about this. Thanks for taking time.
Thank you so much. I appreciate it.
Stay healthy, everyone. We will see you next time on COVID Calls.